When we see patients for consideration of breast enlargement, breast augmentation, a common question is, will these implants make it more difficult to detect breast cancer? And the answer is they do make it more challenging, but yet a patient can expect to have a good surveillance of their breast with typical techniques such as mammography, ultrasound, and MRI. Now, the presence of the implant, whether it's saline or silicone, will make, as I mentioned, the mammography more challenging. And so when a patient presents for mammography, when there's an implant in place, a special technique is utilized. It's called the pinch technique or the displacement technique or the Eklund Technique. Eklund is E-K-L-U-N-D, named after the physician who designed this technique. When a woman has a mammogram without an implant, typically the breast tissue is compressed between the two plates and two different views are taken. When an implant is present, the implant is displaced posteriorly, meaning it's pushed back. The breast tissue is drawn off of that, and only the breast tissue is compressed between the plates. But in some patients, not all of the breast can be seen. If there's any concern about that part of the breast, an MRI can be performed, which will show the entire breast. There's really no difference in difficulty in mammography between silicone and saline. Studies have shown that occasionally breast cancer detection is delayed because implants are in place. But these studies also show that in no case has the prognosis changed, meaning that the outcome of the cancer hasn't changed because the delay in detection isn't long enough to actually affect the outcome. And so in conclusion, a woman who's considering breast augmentation can do it with the confidence that their breast can be adequately surveyed if it's done in a center used to performing mammography on patients with breast implants. So it's very important to make sure that the technician knows that you have implants in place before you have your mammography.